Okay, we are live. Good afternoon, everyone. Today's session is going to be really helpful, and it's led by Dr. Rajsri Sankar from Apollo Cradle and Children's Hospital. She's going to talk about what are the stages of labor. So stick around until the end and ask us questions if you have any. Doctor, you have the stage.
Thank you. Thank you. Good afternoon, everyone. I hope this talk is going to be informative. So I'll try to keep it as practical as possible so you can use some of those tips that we can discuss about today. So before we get into those tips that I want to tell you about, let's start off with the different stages of labor. Now, so after going through 37, 38 weeks of pregnancy, it then gets to the stage where it is now time for the baby to actually make his or her appearance outside. And for most people, this actually means going through a process of something called labor. There will be a small group of women who are not eligible for labor who will need an elective cesarean section. So, but for the vast majority of all pregnant mothers, the process of the baby coming out is through a process of labor leading to a vaginal delivery. So, what are the different stages of this process? Now, we basically divide this process into three main stages. Now, the first stage of labor basically involves the labor pains, where you get pains, you progress in labor up to the stage when your cervix becomes fully open. Now, the cervix is basically the mouth of the uterus, which basically has to open before the delivery happens. So, from the stage of when the cervix is closed to the stage when the cervix is fully open inside is the first stage of labor. The second stage of labor basically involves the stage when the cervix is fully dilated till the baby is born. That actually gets called the second stage of labor. And the final stage, which is the third stage of labor, involves the delivery of the placenta. The placenta is basically the organ that provides the nutrition and oxygen supply to the baby. So that actually gets transferred from the mother side to the baby through this organ called the placenta. Now, delivery of the placenta involves the third stage of labor. So this is how labor is basically divided into. Now, the first stage of labor is the part of labor that takes the maximum length of time. Now, for most women, there will be contractions called Braxton Hicks contractions, which are actually painless contractions. That's when you feel your uterus going tighter and then relaxing. This can happen anytime from the second trimester, where we say from any time from about 24, 28 weeks until actual labor starts. You can experience these painless contractions where you feel your uterus tightening, but you don't actually experience too much discomfort. Now, these are called Braxton Hicks contractions, and some women might not feel them at all, but for most women, this is something that they can experience, usually in the third trimester of pregnancy, which is any time from about 28 weeks till they actually get into labor. So, what happens when actual labor pains start? What we have to realize is that for a woman going into labor for the first time, this is not a process that happens very quickly. It usually takes about 12, 14, 16 hours now. So, this is a long process that happens. So, the first thing when you go into labor is to be prepared for labor to take that length of time. So, what happens when you start going into labor? You find that the contractions start to get more painful. So, initially, it might not be so painful, but the pains gradually builds up. You will also find that the spacing between your contractions start to become lesser and lesser. So, what happens in the first stage of labor? The pain starts. You start to feel uncomfortable. You start feeling these contractions a little bit more, which might be in the front or it might be in, you might feel it more in the back, but this is a coming and going pain. You feel your uterus tightening, the pain builds up, your uterus relaxes and the pain goes away. Now, in the early part of labor, there might be a lot of gap between contractions, and also they might not be so intense. So, knowing that labor takes a long time, there is no reason to rush to the hospital soon as you feel a contraction. Observe these contractions for at least 2 to 3 hours. When you have to go to the hospital is when you start to feel very very uncomfortable with the contractions. The contractions are happening every 5 to 10 minutes, and they're lasting for at least 30 to 60 seconds. This is probably the time when you should think of making your way to the hospital. It's always a good idea to spend this early part of labor. We call this part of labor the latent stage, because this can go on for quite some time before you get into the active part of labor. So this can go on for a while. So try to spend as much of this time possible at home in your own comfortable surroundings. Try to keep yourself comfortable by doing some stretches on your back, staying active, yeah, having a hot bath. So you can try all this at home. But when you find that you're getting contractions that are feeling much more uncomfortable, then it's probably time for you to actually make your way to the hospital. At this phase, also, you might notice that you sometimes have a bloody mucus discharge, which is usually what is called your mucus plug. What is in your cervix, in the canal that's leading outside from the uterus, normally is closed with mucus, what we call a mucus plug. So during this early process, what happens is your cervix, which is the tube coming from the uterus, starts to soften and starts to open up. And then this mucus plug gets released. And what you see outside is a mucus and blood mixed discharge, what we call a show. This is a sign of early labor, and it's nothing to be worried about. Of course, if you have active bleeding, then that is one of the situations when you need to get yourself to the hospital um, as soon as possible. Now, the other thing that might also happen during this early process of labor is that you might start to leak water from the vagina. For some women, the breaking of the waters can happen very very early in labor, and for some people even before contractions start, leaking of water can happen. This is also a sign of early labor, and it is probably time then for you to go to the hospital. So what happens when you feel that the contractions have gotten very strong? Then you're basically moving on to the active part of labor. So the initial latent part of labor is when your cervix, which is initially like a tube, starts to shorten and starts to open up. So this is when it moves from being completely shut till about 3 centimeters open. This is what takes a lot of time, which is probably better spent at home. Now, once you reach that part of labor, the contraction starts to become much more intense. So you start to feel contractions every 3 to 5 minutes, and they can start to last longer too, which can last from about 30 to 60 seconds. So this basically is the phase when you go from about 3 to about 8 centimeters. This is called the active phase of labor, and this is probably a time for most women when they would find that they would need some form of pain relief. So this is probably a good time to make your way to the hospital. And once you reach there, basically what will happen is you will be examined to assess what exactly is going on and in what part of labor you are, how much your cervix is dilated. At the same time, the baby will also be checked out to see what the heart rate pattern is. Now, for most women who have no special risks, either in pregnancy or any anticipated problems for either the mother or the baby in labor, it would be perfectly okay to just record the baby's heart rate initially for about 15 to 20 minutes, and then disconnect the baby's monitor from the mother and let the mother mobilize as much as possible. Now, we do know this process is also going to take another 6 to 8 hours. So, it will be a good idea as a pain relief measure for the mother to stay active as much as possible. You can try different positions like sitting on a chair comfortably, walking around, doing some back stretching exercises, maybe trying to go on all fours like a cat or a dog position. So try all these methods to help you cope with the contractions. It would be very good for you to have a support partner in pregnancy or in labor with you. Most times this is usually your husband, but if your husband is uncomfortable with being with you during this process, it would be a good idea to have a friend who's actually been through this before, or even your mother or a relative who can support you through this phase of labor. And so having somebody to reassure you always gives you a better chance of having all this process happen naturally. So have this person with you They can help rub your back during your contractions, which will give you some relief from the pain, and also give you gentle support. From What you can also do during this phase is walk around, because gravity does help the baby's head come down and fix better in the pelvis. So walking around definitely helps. There are different forms of pain relief that you can ask for during labor. And apart from the tablets and injections which you can be given to take away the severity of the pain, there's a special gas that you can breathe called Entinox, which again helps with taking away the severity of the pain. For people who are not able to cope in spite of taking all these the injection and the gas, there is something called an epidural which can be given in labor, which basically gives you painless labor. What this involves basically is putting in a fine tube into your back, through which local anesthetic is pumped continuously. What this does is it numbs the nerves that take the pain of labor. So what it doesn't do is stop your contractions. You will still continue to contract, but what this will do is take away the pain of labor. But this involves you being in bed. So you work with the epidural, you will not be able to walk around, but you will be in bed. But what you will find that you will be much more able to cope with contractions. So if it's a balance being doing a cesarean section because you're not able to cope with pain, or having an epidural, I would definitely suggest that you get an epidural to give you a better chance at having a normal labor and delivery. So this is something that you can request, or you can even ask before whenever you register with your hospital whether this facility is available. This is usually done by an anesthetist in labor. So this is something that you can request if you find that the contractions are very difficult to bear. So, what you can do from your side, like I said, if you are able to cope without an epidural, well and good, stay as active as possible. What you can do is keep drinking, having enough liquids, taking some juices will also help to help you conserve your energy too. So these are some things that you can do to help yourself through this process of labor. Now, once you have gone through this and your cervix has gone to about 8 centimeters dilated, you will find that the contractions become quite intense, with one contraction going into another. And this is a phase called the transitional phase, where you move from the first stage of labor to the second stage of labor, which is when your body is getting prepared to push the baby out. So you'll find that contractions have start to become very intense. They might be one on top of another, and you might find the pains difficult to bear, which is a good time for you to start using the gas and air, which will help to take away the intensity of the pain. So you might find that it might be difficult for you to move around at this stage. So you might feel more comfortable being in bed at this stage. So what happens during this phase is you will feel that you want to start bearing down, which means pushing down, but your nurse or doctor will tell you when to actually do that, because sometimes if you start pushing when the cervix is not fully open, it might actually hinder the natural progress of labor. So you will be examined more frequently during this phase, and your baby will also be more closely monitored during this phase. So your first stage of labor is now coming to an end. So what started off 8 to 10 hours ago is basically coming to an end now, and you're actually getting to the second stage of labor, when you're getting ready to actually push the baby out. So the second stage of labor is usually much shorter than the first phase of labor. So at this stage, your contractions are still intense, but they will come more regularly, and they will be lasting up to 30 to 60 seconds. For some women, the contractions may start to go off at this point, during which time your doctor might decide to give you a hormone drip which makes your contractions stronger. This might also be required in the first stage of labor, when the labor starts to slow down and we are not making progress. You might need additional hormone support, which is basically giving you something called an oxytocin drip. So during the second phase of labor, for most women, you might what might happen in the second phase when you start to actually push is that you will feel the baby's head starting to push down on your motion passage, which is your rectum. So you might feel the pressure there. So you might feel that you actually want to pass motion. And it's perfectly okay to do that. Passing motion in during labor is completely normal, and you do not have to feel shy about that part of the process. It is absolutely normal when the baby's head is pushing on your motion passage, that your bowels will empty, you will pass motion, and that is perfectly normal. So you do not have to feel shy about that at all. So during the second phase of labor, when it's ready for you to start pushing, the doctor will let you know. And what you will have to do at that stage is start to bear down, push down with every contraction. So your doctor will tell you when that process, when you have to start doing that and how you need to do that also. Generally, what we would say is with active pushing, you actually hold your breath and try to give long pushes to help to push your baby down the birth canal. During this phase, also, your baby will again be very closely monitored. The heart rate will be closely monitored to make sure the baby is coping with the stress of labor. So at this phase, you will actually feel quite a strong pain on your rectum, which is your motion passage, and that's the baby's head coming down. And you can feel some kind of burning too, especially when the head starts to reach the outer part of the vagina, and there is stretching of the outer part of the vagina. At this stage of labor, your doctor will usually give some local anesthetic to the outer part of the vagina. And this is usually to help uh, widen the space if required. Uh, there will be a cut given called an episiotomy, which you will not feel because you would have had local anesthetic given in that space. Now, an episiotomy is a cut given at the outer part of the vagina to give extra room for the baby's head to come out. And this is not routinely done for everyone. It is done when we feel that the vagina is not stretching enough. So, if that happens, if the vagina is not stretching well and the head is pushing hard, it might cause tears that might be much more difficult to repair and might cause more damage. So, in situations where we feel that the tears are likely to be worse, then it would be better for you to have this episiotomy given. Of course, if the baby needs help with either forceps or vacuum delivery, an episiotomy is definitely essential to give extra room for the baby's head to be delivered. So once that is given, you will be asked to push in a controlled manner. Now, this pushing stage has to be done in a controlled manner so that the baby's head doesn't shoot out of the pelvis and doesn't cause too much damage to your pelvic floor muscles. So, this part has to be done in a very controlled manner. And so, when the baby's head gently comes out, generally we check the baby's neck to see if the cord is around the baby's neck. If that is the case, and if the cord is loose, it's usually taken over the baby's head. If it is not and if it is tight, generally the cord is clamped and it is cut. And then the shoulders are gently moved with the mother pushing, and then the rest of the baby's body comes out. Now, so this is the end of the second phase of labor. So as soon as the baby is born, for most labor nowadays, we do delayed cord clamping. This is to help the extra blood that is in the tube from the placenta to the baby to keep going to the baby. So we do not waste this blood that is in the umbilical cord, which is the tube coming from the placenta to the baby. So once the cord stops pulsating, which tells us that the process of this blood transfer is complete, the cord is then clamped, and then the baby is either directly given to the mother to give skin to skin contact, or there will be situations where we'll give the baby to the pediatrician for the baby to be checked out initially, to make sure that the oxygen status, breathing, all of that is fine, and then the baby is immediately given back to the mother to establish skin to skin contact. Now, this is the end of the second stage of labor. Now, if you remember, I said there was a third stage of labor where the placenta, which is the organ responsible for the transfer of nutrients to the baby, that has to also come out of the uterus. Now, the way the placenta, the delivery of the placenta can either be done by just allowing things to happen naturally, or it can be managed actively. And nowadays, we do manage delivery of the placenta actively because we do know that this reduces blood loss significantly. And what that basically means is giving you an injection to help your uterus contract down further, and the placenta is actually gently removed by your doctor and delivered completely outside. So what happens at the end of this phase is that your vaginal area is checked for any tears, and if any episiotomy is given, this is now repaired in layers. This might take another 15 to 20 minutes for this process to be done. Usually, absorbable stitches are given for the suture episiotomy, which means this does not usually need removal after it is actually put in. So, as soon as the baby is checked out by the pediatrician, then the baby is given to the mother to establish skin to skin contact and to start breastfeeding as soon as possible. We usually aim for breastfeeding to be started within 30 to 60 minutes of the delivery because we do know that this establishes contact between mother and baby much better, helps mother, and by establishing this contact we do know breastfeeding issues are much lesser, and in improving the bonding also helps the mother emotionally cope later and reduces postpartum issues also in the mother. Now, this basically is an overview of the different stages of labor. So, what can you do to prepare for labor? Uh, there is a there are antenatal classes that I would definitely suggest that you attend because most of the times, if you go in unprepared mentally for this process, you might find the whole process daunting. So, it definitely knowing all this will definitely help you. So, I would definitely suggest that each one of you attend antenatal classes where you're actually taught again about the different phases of labor, what you can do, the breathing exercises that you can do, the different stretches that you can do to help you cope with the pain. Now, pain does not happen suddenly and quite severely all at once in labor. It builds up very slowly, and yes, you will have strong pains from the middle to the end of labor, and this is essential for the baby to be delivered. So, how you cope with the pain is something that you need to be prepared for mentally. And doing these antenatal classes, especially with your support person who will be with you in labor, will definitely prepare you for going through this process with much more confidence. So you know what your options are. So definitely attend antenatal classes and actually have a plan in your mind as to how you're going to manage your pains. I find my patients who come in prepared are much more able to face the challenge of labor and have a much better chance of having a normal delivery. Now, what happens in labor, which many need to cesarean section, is sometimes babies do not cope with the process of labor, the pressures of labor, and sometimes labor might not progress beyond a certain point. Both of which we will only know when you're actually going to labor. Now, these are the two commonest reasons for cesarean sections. What I do find is people who come prepared for the process of labor are able to cope with all these changes that are happening, and sometimes it seems that positive thinking and positive action gives them a better chance at having a normal delivery, and also reduces postpartum, I mean, postpartum depression later on when they come prepared for the process of labor. So definitely attend antenatal classes. Start practicing your breathing exercises. Start doing your stretching exercises, all of which actually prepares your pelvic floor muscles for the labor process. So from your side, I want you to do those things before you actually get into labor. And of course, doing breastfeeding classes also helps you with after the delivery of the baby. Now, during labor itself, try to stay active as much as possible instead of lying in bed. Try to walk around as much as possible because gravity definitely helps the head come down. So, as long as there are no high risk or problems that are anticipated either from your side or the baby's side, for most women, it would be good for them to stay as active as possible. Of course, when the pain gets really intense, then it will be difficult to be active, and you might find that lying in bed might help more. Even in bed, try to shift position as much as possible, as long as your baby does not need constant monitoring, which for some in some situations might be required. So you might find that your mobility is restricted in such situations. If that's not the case, try to stay active as much as possible. Do take enough liquids regularly so you do not get dehydrated. Of course, if there are situations where you're not allowed to have, if they are worried that there might be a necessity for a cesarean section, then you might not be allowed to have solid food in labor. Especially once you get into the active phase, you will only be taking liquids, but keep taking juices so you have enough glucose getting into your system, because you are actually losing energy while you are going through this process. And therefore, hydrating yourself, drinking enough liquids definitely keeps you going through this process of labor. And If you have a birth plan, that would be very, very good. Discuss it with your medical professional during, or your doctor, when you actually do your antenatal checks. So my suggestion is, be aware of the process of labor, start to do antenatal classes, and be prepared for the labor process itself, because always knowledge is power. And if you're knowledgeable, you come prepared, then you give yourself the best possible chance of having a delivery. So, good luck with your pregnancy, and I hope you have a safe delivery. Thank you. Thank you. Thank you. No questions? So, thank you.